Thank you very much, Dr. Fox and Dr. McLeod. So I'm going to take us in a slightly different direction right now. So I'm just adjusting. And to talk about when we think about these approaches and when we think about these interventions, about what are some theoretical approaches that can help guide the way that we're thinking. And so I'm going to talk a little tiny bit about relational autonomy and how this can help us to understand persons in their contexts and some of these changes that they may be experiencing both in themselves and in the contexts. And so some of you may have heard of relational autonomy theory in the past, but just a quick recap. In relational conceptualizations of autonomy, these arose as a critique to more traditional views where individuals were viewed as independent, rational beings who were able to make decisions separate from their contexts, about their contexts. And in feminist perspectives, this was seen as perhaps being unrealistic. And so in such perspectives, individuals are considered to be multidimensional in their contexts, and their contexts are layered. And so there would be the political context. What are the social structures? What does the health system look like? What are the services available? What is the social context, which again is multi-layered and would include the people in the immediate sphere, so care partners, people with whom one lives, people in your neighborhood. Then if we move a little bit bigger, people in your town, people in the country, and finally as a citizen of the world. But then there's also the physical context, which is the physical environment, usually most closely where one lives. And so it might be their home. Do they live in an apartment? Is it all on one level? Are there stairs that an individual may need to go up or down several times? Is there an elevator? What amenities are there? And then within those contexts as well, what are some of the things that are required of the individual that they may need to do? And so in order to eat, are they required to make their meals? Are they required to, is there an opportunity to garden? Or what are some of the opportunities that are there? And what are the things that need to be done? And so from a relational perspective, people are perceived to have been both shaped by these contexts, and so they've learned from the opportunities that they've had, but they also have not learned from the opportunities that they've not had. And then they're always acting in their context in relation to the opportunities that are there or the requirements that are there. And so why are we talking about that specifically today? Because in these transitions, it might be helpful to consider how a person is in the context now, but also how they were in their context previously. And so previously, they may have had all of the abilities required to navigate that environment at home. They might have had the strength to climb the stairs when they needed to prepare their meals. They might have had the just right amount of help at the end of a phone call or from a spouse or someone who lived in their context. But in having been admitted to inpatient care, first of all, the reason for admission might have also included changes in their abilities. And subsequently, having been in the inpatient care for a while, again, their abilities may have changed. And so they may have changed, but also so has the context. The setting in acute care is quite different frequently than the setting of a home. And so in acute care, you might have a room with a bed. There's a lot of equipment. There's likely a very large bathroom that's right there. To walk down, you might have to walk down the hall a little bit. You might have to get out of bed. There would be elevators, large flat hallways. In terms of the social context, there would be many individuals to help and to pay attention to any small or large need, medical or otherwise. And there may be family members, but perhaps not at all times, but there always are healthcare experts around. In terms of tasks and occupations that a person might be doing in the hospital or in inpatient care, there are not demands like preparing meals or cleaning up or doing laundry. And so the context, the demands, and the opportunities are quite different. There are also different social roles when a person's in inpatient care. And so people may perceive themselves as patients and in the role of a patient. And the fact that they might be in bed most of the day and would be doing what is expected of a patient. And so this, compounded with the fact that their needs are being monitored and met by trays appearing with meals on them, trays disappearing, bedding being changed, will all change the expectations this individual has of themselves in that setting. And so when they do return home, a lot of the context is, again, going to change. It's going to go back to that home setting. And so there may no longer be a fit between what they're able to do and what they're required to do. Having said that, people can step back into previous roles upon their return, but with a lack of support that they had in the hospital, it might be difficult. And so in such transitions, it's really a matter of finding that fit. And in finding that fit, this is what we're trying to do in this project, between the demands of the environment and what the person is able to do. And so it's important to remember that it can be difficult for individuals to envision how they might look upon discharge when they're back in their home environment. They might imagine themselves back home with the capabilities that they used to have. And maybe that will be so in the future again, but likely not right away. And so it might be difficult for patients to imagine this throughout the transition. Similarly, it can be difficult for healthcare providers to envision how the person might be in their home environment. And in these care transitions, it's important to have everyone communicating and bringing what they see and know to try to maximize this person's experience. And so taking a relational approach really helps us to consider the person in relation to their context and how both of those might be changing, the context as well as the individual. So that was a little bit of a theoretical consideration to some of these projects, but we would invite discussion and conversation about all aspects of what's been discussed today. Thank you very much.